The bones and ligaments of the lower leg include the tibia, fibula, and bones of the foot, as well as the knee and the ankle ligaments. Starting with the tibia, and the tibia, also known as the shin bone, is the larger medial weight-bearing bone of the lower leg. So our tibia is this bone here. The tibia articulates proximally with the femur and also the fibula, and then distally with the talus of the ankle and again the fibula. The tibia and the fibula, which is this bone here, are connected by an interosseous membrane. The proximal end of the tibia expands into lateral and medial condyles. These condyles articulate with the condyles of the femur. The inferior surface of the lateral condyle also articulates with the head of the fibula. On the proximal anterior surface is the tibial tuberosity, which you can feel on the front of your shin, just underneath your patella. And the tibial tuberosity serves as a point of attachment for the patellar ligament, which anchors the patella to the lower leg. Inferior and also continuous with that tibial tuberosity is our anterior crest. It's the sharp ridge that you can feel as your shin bone below the skin. And then on the medial surface of the distal end of the tibia is our medial malleolus. And so this structure articulates with the talus of the ankle and also forms that bony bit that you can feel on the inside of your ankle joint. The fibula is parallel and lateral to the tibia and is also considerably smaller. So we mentioned that our fibula is this bone here and here. So it sits on the lateral side of the leg. Unlike the tibia, the fibula does not articulate with the femur. So you can see it actually doesn't connect to the femur at all, and therefore it's not weight bearing. The function of the fibula is to help stabilize our ankle joint. The head of the fibula is the proximal end, which articulates with the anterior surface of the lateral condyle of the tibia. The distal end is shaped more like an arrowhead and forms a projection called the lateral malleolus. So our malleolus again articulates with the talus of the ankle and forms that bony projection that you can feel on the lateral surface of your ankle. We then have a styloid process, which is a slender projection of bone, which serves as a point of attachment for either ligaments or tendons. And we have styloid processes on various bones around the body. On the head of the fibula, and you can see it best on this image here, you kind of had that little point up the top. This is our styloid process of the fibula. Now, I don't need you to be able to identify this landmark, particularly on the fibula. I just want you to know that a styloid process exists and that it's found throughout the body. Moving on to the foot, and similar to the hand, the foot is made up of 3 regions of bones. So we have 7 tarsal bones, which form the ankle and the proximal foot. We have 5 metatarsals, which form that mid portion of the foot. And then 14 phalanges, which form your toes. Now, looking at the tarsal bones more carefully, and you will need to be able to identify all of these bones, unlike the hand where you only needed to know 2. And the first tarsal bone is the talus. And the talus sits most superiorly, and it's what articulates with the tibia. So the tibia and the talus fit in together quite nicely. The calcaneus or calcaneus is the posterior portion of your foot. It forms the heel bone. The navicular bone is this curved bone here. It sits anterior to the talus. On the other side, we have our cuboid bone. So our cuboid bone is shaped like a cube and it sits more laterally. Anterior to the navicular bone are 3 cuneiform bones. So they're named the first, second, and third, or the medial, intermediate, and lateral cuneiforms. For this unit, you can just simply refer to them as cuneiforms. The metatarsals are these 5 bones here, so numbered 1 through to 5, starting off with our big toe, so this one here, our big toes here. This first metatarsal is thicker because it bears much more weight than the rest of the metatarsals. And then our phalanges are similar to our fingers, or the phalanges of the hands. So toes 2 to 5 have a distal, a intermediate, and a proximal phalange. Our big toe only has a distal and a proximal phalange. Now, we also tend to have sesamoid bones within the feet, which remember are bones which develop within a tendon. On this posterior surface here, you can see 2 of those sesamoid bones here. They look a bit funny because they haven't got the surrounding tendon. And similar to the styloid process, I don't need you to specifically identify these sesamoid bones, but you do need to know what a sesamoid bone is and be able to provide an example. Moving on to the ligaments, and starting with the ligaments of the knee, and forming across at the front of the knee is the anterior cruciate ligament, which you may have heard referred to as your ACL. Cruciate within the anterior cruciate ligament refers to a cross. So you can see these ligaments form a bit of a cross. Now this ligament extends posteriorly and laterally from its anterior position on the tibia to the medial surface on the lateral condyle of the femur. This ligament helps prevent hyperextension of the knee, so bending it kind of beyond straight, and also the anterior sliding of the tibia relative to the femur. So you don't want your tibia going any further forward than your femur. The posterior cruciate ligament, or PCL, sits posterior to the anterior cruciate ligament. It extends anteriorly and medially from its position on the posterior of the tibia to the lateral surface of the medial condyle of the femur. The posterior cruciate prevents posterior sliding of the tibia, particularly when the knee is flexed. So we don't want the tibia going back behind the femur. And this is particularly important for movements like walking down a steep incline or walking downstairs. The medial collateral ligament, which is sometimes also referred to as the tibial collateral ligament, runs along the medial side of the knee. It runs from the medial condyle of the femur to the medial condyle of the tibia. And this ligament is actually further strengthened by the tendons of the sartorius, the gracilis, and the semitendinosus muscles, which all run across this ligament. So they all help support this side of the knee. Our lateral collateral ligament, which can also be referred to as your fibular collateral ligament, is a strong rounded ligament, obviously on the lateral surface of the knee. It runs from your lateral condyle of the femur to the head of the fibula. This ligament strengthens the lateral aspect of the joint and is covered by the tendon of the biceps femoris muscle, which is one of your hamstring muscles. We also have a patellar ligament, which is this ligament here. And the patellar ligament is a continuation of the insertion of the quadriceps muscle. So if this is one of your quadricep muscles, this is our quadriceps tendon, connects onto our patella, and then that continues connecting the patella down onto our tibial tuberosity. So this top part is our quadriceps tendon. This bottom part is our patellar ligament. Moving inferiorly, and then there are 4 main stabilizing ligaments of the ankle. So the deltoid ligament, which sits on the medial surface of the ankle, consists of 4 smaller ligaments that form a bit of a triangle, a very loose triangle, that connects the tibia to the navicular, the calcaneus, and the talus. Collectively, and it's the only ligament or group of ligaments that will look on the medial side of the ankle, it helps stabilizes the ankle joint during eversion of the foot. So that's when the sole of your foot faces laterally. On the lateral side, we have our anterior and our posterior talofibular ligaments. So connecting our talus to our fibula. Both of these ligaments help resist inversion. So this is when the sole of your foot faces medially. We then have the calcaneofibular ligament, which is this one here, connects the calcaneus to the fibula, so from here to here. And it helps assist in stabilizing the talofibular joint during dorsiflexion. So that's when you bend your toes up closer back towards your shin.